Okay, so mental illnesses are pretty common now in, at least in America. 18.2%, or at least 42.5 million Americans are diagnosed with mental illness, and that's from Newsweek.com. So, I mean, like, you know when you see those people, like, on the side of the road, like, I know for a fact there's a guy that loves to sit on the corner of Harbor and Imperial, and he loves to just sit there talking to himself, pointing at cars, laughing, and, like, he's having a great time, but, like, he also shows, like, classic signs of, like, schizophrenia, which mainly that's what homeless people dive into. But that's what I'm going to be talking to you guys today, is mental illnesses. So I'll be talking about, like, the causes of mental illnesses, the types, a few types of them, and, like, some treatments. So what is a mental illness? It's a health condition involving change in thinking, emotion, or behavior, and that's from psychiatry.org. And some causes of mental illnesses would be abnormal balance of neurotransmitters, which neurotransmitters help nerve cells in the brain to communicate with other cells within your body. And this is from the Kim Foundation. And some other causes of mental illnesses would be like infections, some infections, substance abuse, poor nutrition, exposure to toxins such as like lead or mercury, prenatal damage. And so like some infections would be like a pediatric autoimmune neuropsychiatric disorder, and this is linked with OCD, and this is from the Mental Health Institution. And so this disease is called PANDA, and there's quite a few of them, but this one specifically may show up right after you have like strep throat or scarlet fever. And so like OCD signs will appear. They'll suddenly appear, and then when that kind of happens right after the strep throat or scarlet fever, if you go to the doctor, most likely you'll be diagnosed with the pediatric autoimmune neuropsychiatric disorder. Also, like such as like the prenatal damage, if you have disruption within the development while you are a fetus, this will most likely lead to autism. And then a few types of mental illnesses, according to WebMD, would be, as we all know, like depression, which is like a depressed mood, a loss of interest in activities you normally like, and all you want to do really is just kind of like be alone. You want to like be in a dark room, maybe be by yourself instead of like with others like you usually are. There'd be anxiety, which is like when you have the feeling of like worry, anxiety when you're anxious, thinking that there's like not enough time. And then you have fears, irrational fears as well. So such as like, as well as the time, so like it would be, I don't have enough time for this speech, or I don't have enough time to prepare myself for work or for school. So anything like irrational fear like that. There's also bipolar disorder, which is like episodes of mood swings. So they range from like depressive lows to where you don't want to get out of bed, you won't speak to anyone, to extreme highs where they call it's like a manic happy, because you have so much like adrenaline going out through your body, and you're just hyper, and all you want to do is just go out and do something, and you wear your entire body out until you go back to your depressive low, and that's where your body's trying to restore, and then you're back up to your extreme highs. There's also schizophrenia. So this affects a person's way to behave clearly, think and feel. So, for instance, like the people who are on the side of the road, like the man on Imperial and Harbor, he loves to talk to himself. He has like his own little chair, he'll sit there, he'll point at cars, and like he just laughs for whatever reason is going on inside of his head. Some treatments of mental illnesses, according to Medicine Net, would be like medication, psychotherapy, group therapy, and even breathing exercises, which would be mainly for anxiety. Psychology today said that medication will can help correct and balance the neurotransmitters that I had mentioned earlier. And then the psychotherapy, it helps like when you're talking with a certified like psychiatrist or a therapist to help resolve conflicting conflicts that you have, conflicting problems, and you're on a one-to-one basis. There's group therapy, so you're learning how to cope with others and realize you're not alone. There's others dealing with this, and so you help kind of resolve your problems along with others instead of on a one-to-one basis. And then breathing exercises, as I had mentioned earlier, it mainly for those with anxiety, and it helps slow down heart rates and helps you to relax. That way you don't kind of like overwhelm yourself. And so with that, mental illnesses are just something that people do need to be aware of. It's a serious thing. They're serious things, but sometimes they can be treated and sometimes they can't.
Well, I would think the statistics at the beginning help get our attention and make the subject seem more important and something that we should be paying attention to. Your general thesis is fine. There's an excellent preview of what the structure is going to be. So organizationally, you're set up pretty well. I thought that you did a good job for the most part citing sources during the presentation. There are a couple of times where the source citation comes after the information, and that's always a little bit confusing when we get back-cited, so it's kind of having to track back a little bit. So try to make sure that you give the source citations before you present that particular information. I wasn't quite sure what the PANDA thing is. It felt like there's something here that I needed a little bit more detail on, and there were a couple of other references to other illnesses that people suffer from that probably need a little bit more description. We're getting a very surface kind of introduction to these sorts of things, and there are so many of them that I'm not sure that that's maybe the best way to do it, although it was a pretty good primer on some of the issues that people with mental illnesses face. So I thought that, it kind of, straddles the boundary between being a little bit too much to cover and just enough. Since it is kind of a what would we call that? A survey kind of presentation. I think you can get away with it. Visual factors in the presentation. Well, you're not moving around a lot like everybody else does. The one thing that I noticed that I thought was a little bit of a problem at the beginning of the speech is you got your ankles crossed at one point instead of standing funny. Put both feet on the ground, and I think if you get off a better start when you feel that way, you're going to have less anxiety and more like you're in control. You did finally do that sort of thing, and I thought that you came across pretty effectively. Your gestures, you have some nice indicators and descriptive gestures as you're talking to us. Facial expressions are satisfactory. I think you're making a deliberate attempt to kind of be contained and subdued and not be anxious. But I do think you also want to be a little bit more personable sometimes. There was nothing that was wrong with what you did. stuff to add in the presentation. I think your eye contact's actually very good. You do have a tendency to talk to us, and even though you are using notes, you're not overly dependent on the notes. You basically use them to remind you of what you're going to be talking about next. Were a couple of places maybe some visual aids might have been appropriate. You're not required to use the visual aids, but when you were talking about the neurotransmitters and you had the list of medical treatments that people had, it seemed like this would have been a place where you could have supplemented a little bit and gotten a little bit more content. Your voice, the only thing I think is a little bit problematic about your voice is that you tend to be a little quiet while you're speaking. You got a cold? Yeah, a little head cold. It's always tough when you got a cold because it's hard for you. It's sometimes painful to do that, and of course projecting is a little bit more complicated. So it wasn't disastrous. I mean, it was fine. I just thought, like the animation thing before, you could probably do a little bit more, but you have to sometimes operate within the physical boundaries that are available to you. So that was fine. Okay, thank you.